This is the presentation for breast cancer for systemic pathology. In this presentation, we will be discussing on the epidemiology, etiology, pathology, types of breast cancer, treatment as well as screening. The most common invasive cancer in women is breast cancer. This is the second main cause of death after lung cancer, even for women. The chance of any woman dying from breast cancer is around 1 in 37, which is pretty high amount. This is the statistics for global. So in 2017, 2,000 plus new diagnoses is reported, in which around 40,000 women are likely to die from the disease. In men, breast cancer can also occur, but it is a rare cancer that forms in the also breast tissue. It is most common in older men, though it can occur at any age, and it has low mortality rate. For the etiology of breast cancer is highly heterogeneous, which means its etiology and pathological characteristics vary for each type, and it also has a lot of subtypes, which depends on genetic, on the gene that causes it. And some cases show slow growth with excellent prognosis, others taking highly aggressive clinical course. This is stated by Verma R in 2012 from her article. So, like I've said before, breast cancer is highly heterogeneous. It has various characteristics. One of the main gene that is responsible to cause breast cancer is HER2 oncogene, HER2 oncogene, which is related to epidermal growth factor receptor family, and it is overexpressed in approximately 20% of the breast tumor. So which means in the cases reported with breast tumors, 20% of the cases is related to overexpression of HER2 oncogene. HER2 oncogene is the gene that plays role in breast cancer development. So next is another type of breast cancer, which is the NBC, triple negative breast cancer, which shows no expression of either of the tumor gene as well, which includes ER, PR, or HER2, like I've mentioned before. Triple negative breast cancer is generally higher in younger women, African American women, and in patients with mutated BRCA1. So this type of breast cancer, triple negative breast cancer, accounts for 15% of the breast cancers globally. And the next cause that may result in breast cancer is the chemokines, which have been implicated in playing a role in breast cancer progression. Also, a strong family history of breast cancer can also increase the risk factor, age and reproductive factors, as well as mutations in a woman's own body. The risk factors for breast cancer first will be age, in which the older you are, the higher risk that you might get certain types of cancer, but most types of breast cancer. So at 20 years, the chance of developing breast cancer in the next decade is 0.6%. By the age of 70 years, this figure goes up to 3.84%. So it does show that when you grow older, you may have an increased chance of getting breast cancer. Next is genetics, which is if someone has a history of having breast cancer or any other type of cancer, one will have an increased risk of having breast cancer. Women who carry the BRCA1 and BRCA2 genes, it's written here. This gene is the breast and ovarian cancer susceptibility gene. So this is the gene that causes most of the breast cancer and ovarian cancer. It includes a nucleoprotein whose mutations associated with both inherited and sporadic cancer. This is the main genes that is causing breast cancer. These genes can be inherited. TP53 is another gene that is linked to a greater breast cancer risk. Next is dense breast tissue can also contribute to increasing risk factors of having breast cancer. So the next risk factor is estrogen exposure and breastfeeding. Being exposed to estrogen for a longer period increases the risk of breast cancer. Due to starting periods earlier or entering menopause later than average, between these times estrogen levels are higher. So the longer time you are exposed to estrogen, the higher risk you will be getting breast cancer. Breastfeeding reduce the risk factor to get breast cancer. This is because breastfeeding, especially for over 1 year, it appears to reduce the chance of developing breast cancer. This is due to the reduced exposure to estrogen. So breastfeeding women does not produce as much estrogen. Next is body weight. Women who are overweight or have obesity after menopause may have a higher risk of developing breast cancer, possibly due to higher levels of estrogen as well. High sugar intake may also be a factor.
Okay, next we move to type of breast cancer. Breast cancer can begin in different areas of the breast, the duct, the lobulus, or in some cases the tissue in between. Classification on major categories: histopathological type, the grade of the tumor, the stage of the tumor, and the expression of the protein and gene. Ductal carcinoma in situ, DCIS. It is non-invasive. Ductal cancer starts inside the milk duct and hasn't spread beyond the milk duct into any normal surrounding breast tissue. Okay, this is a pathological appearance. Ductal hyperplasia or overgrowth, too many cells are present. Atypical ductal hyperplasia cells are starting to take on an abnormal appearance. DCIS, too many cell features of cancer but are still confined to the inside of the duct. DCISMI, few of cancer can start to break through the wall of the duct. IDC, cancer cells have broken beyond the breast duct. Cancer is no longer a DCIS but an invasive ductal carcinoma, most common type of breast cancer. IDC can be diagnosed at any stage from 1 to... Okay, next is invasive ductal carcinoma, IDC. It is the most common type of breast cancer. About 80% of all breast cancer are invasive ductal carcinoma. Cancer has spread to the surrounding breast tissue and more common as women grow older. Pathological appearance: tumor proliferation of ductal epithelium, solid tumor, grey whitish, usually with irregular borders, infiltrating the adjacent adipose tissue. Consistency is firm to hard due to the marked desmoplastic reaction, sometimes with calcification. Okay, a typical tumor cell from ribbons, tubules, or nests penetrate the basement membrane of duct and infiltrate the surrounding tissue. Perineural space. Frequently, tumor necrosis is seen. Carcinoma or ILC. It is make up about 10% of all invasive breast cancer, tend to occur a little later in life than invasive ductal cancer. The pathological appearance: it's uniform population of small to medium-sized tumor cells that exhibit lack of cohesion, slender strands or single file in a concentration fashion around duct or lobulus. Lymphocytic infiltrate is frequently present. breast cancer or IBC. It's a rare and aggressive form of breast cancer. About 1% of all breast cancer cases in the United States. It tends to grow and spread quickly, usually start with the reddening and swelling of the breast instead of distinct lumps. The stages of IBC. Stage 111B. Cancer has spread to tissue near the breast. Cancer may have spread to lymph nodes. And stage 111C. Cancer has spread to lymph nodes. Cancer also may have spread to lymph nodes within the breast or under the arm and to tissue near the breast. And stage 4, cancer has spread to other organs. These can include the bones, lung, liver, or brain, as well as the lymph nodes in the neck.
Right. Moving forward to detecting breast cancer, an early detection may reduce the mortality rate and increase chance of treating the disease. So, detection may be screening, breast self-examination, monthly exam of the breast and underarm area, discover early changes, menstruating women 5 to 7 days after beginning of their period, and menopause women same date each month. Next, clinical breast examination, which can be done annually for women over 40 years and at least once every 3 years for women among 20 to 40 years old. And mammograms, X-ray has been shown to save life of patients aged 50 to 69. Asymptomatic women 40 and over should have mammogram every year. Moving forward to treatment for breast cancer, it can be done by surgery, which is lumpectomy, modified radical mastectomy and reconstruction, and also can be done radiation therapy, chemotherapy and hormonal therapy. Okay, prognosis after breast cancer. For stage 0, 5-year survival is 95% and 10-year survival is 10%, which is then stage 1 is 5 years survival is 85% and 10-year survival is 70%, while stage 2, 70% for 5-year survivals, 50% for 10 years survival. Stage 3, 55% for 5-year survival and 30% for 10-year survival. And moving forward to stage 4 is the most serious stage. 5 years survival is 5% and 10 years survival is 2% only.